everyone. Happy Twin Wednesday.
Twin Wednesday.
Dr. Johanna here.
Dr. Madeline.
We didn't want to confuse you, but we had to pause Twin Tuesday yesterday and resume it today.
It's Twin Tuesday on a Wednesday today.
Yeah, so thanks for your patience, and we have an awesome episode for you today. But I know we introduced ourselves, but who are we, where are we at, all that good information, right?
Right. Well, I'm Dr. Madeline. We are at Liz Chiropractic Center, and we are in sunny St. Petersburg, Florida, where we see your whole family.
Absolutely. So, and today we are going to talk about an awesome topic, right? You had the opportunity to personally speak with an awesome pediatrician in the area.
Yep.
And they had a lot of questions about chiropractic care and how that can help little ones in their practice, and how we can help incorporate that, and like what are some things that we would be checking kids for, how does it work, what's it look like, what can we help, all of that stuff. So we are laying out the top three or four questions.
But yeah, so I talked to a local pediatrician the other day who wanted to connect and ask us lots of questions, which I thought was a really cool opportunity because sometimes there's still a huge disconnect between like your mainstream medical world and your more holistic medicine, chiropractic type of world. So, but what is cool about, I feel like every day that goes by, is we integrate a little bit more and more, especially with the newer doctors graduating from med school and the new chiropractors and stuff getting out, is we do know health is a spectrum, and there is multiple ways to support a patient on the ways that they want to be supported, and how do we come together in that, because a lot of people are sometimes getting them together, which is great. So how do we just support? So she asked us lots of questions, so I thought it'd be cool to share with y'all what the questions were, because I feel like they're pretty common questions that we get from quite a few people across the board, especially when it comes to treating kiddos, which is what we're going to focus on today.
Yeah, absolutely. And make sure that if you're catching this later, you hashtag replay, right? Let us know when you're watching it. If you're current, drop some emojis. Show us that you like your topic. If you have some kiddos at home, tell us how old they are. What are you liking this homeschool, or you're not? Are you back in school? Like, it's crazy times, but I'm hearing all kinds of neat things out there, so that's cool.
Yeah, so one of the very first question, I feel like not only did she ask me, that we get all the time, is it safe to adjust kids?
Oh, yeah, absolutely. And it's not only safe to adjust kids, but there are other chiropractors out there too, like us, that have taken additional training on the ways to like just engage with them and adjust them in different ways, and have all kinds of tools in your tool belt because sometimes you have kids come in and they may not be as easy and as compliant as an adult may be.
Yeah.
So there's all kinds of ways that we have to learn to work around that and provide them with the type of care and adjustment that they need.
Yeah, and I would say like a huge thing that we do recommend parents, if the parents are already coming in and maybe they want their child to be checked, is to bring them in with you during your appointment before we even ever try to check them, just so they become a lot more familiar and comfortable in the office, and they start to learn us and become more comfortable with us, because kids are used to going, especially like in their first year of life, to the medical doctor quite frequently, and sometimes those visits aren't very much fun for the kids, and that's like they already know this and remember that. So then sometimes when you bring them in our office, they just know you told them we're a doctor, and they do not trust us. They think we're going to poke them, prod them, hurt them, and rightfully so. Like, they're going to the other doctors, that sometimes that's happening. So bring them in so they can become a lot more comfortable. See that this is a fun environment. We have toys. It's safe. It's supposed to be like a loving, fun place. So.
Yeah. And the one reason that it is safe to adjust kiddos is they have spines and nervous systems just like adults do. I mean, of course, they're smaller, but because of that, we do not use the same amount of force or possibly even the same amount of technique on their little spines and their nervous system. And what we do is to accommodate them, no matter if they're just, a couple hours old, or if they're 16, 17, brute playing football. Like, we know all kinds of ways to apply the right amount of force that needs and allows the adjustment to happen, but it's very safe and it's very effective.
So the next question she did ask me was, because she had been adjusted before, is do we adjust them the same as we do adults, especially infants and newborns? I said, absolutely not, as we just talked about. And if you followed us for a while, you know when we do talk about especially adjusting a baby, it is much different than adjusting an adult, where we're just doing gentle pressure, like the pressure you would choose or use to check the tomato and see if a tomato is ripe, is pretty much the pressure all we have to use to adjust that baby. We are not what we will say, not that this is technical terms, but I think this is what a lot of people think. We're not racking them and cracking them like we do adults at all, or forceful adjustments.
So if your only experience with chiropractic is perhaps some of those crazy YouTube videos out there, that is not what we're doing on adults. It's also not what we're doing on kiddos.
Yeah.
So yeah, like Dr. Mallon said, about the amount of pressure you would see if a tomato is actually right, and that's all that they need, and it's really awesome. And a lot of times, actually, if they're really small and they're sleeping, a lot of times they actually sleep through the adjustment because it is so gentle. So that's cool.
Now, when they do become a little bit older, where they do start to be weight bearing and things like that, then the adjustment, I will say, I think looks similar to what we do to an adult, depending on the method we're using, but we definitely are not using the same amount of force or anything like that. And I think it's just a good point to reiterate that we did go to school and we did learn how to do this, and there's special training that we did take on top of this to understand what's more appropriate for a child versus an adult.
Yeah.
But we do the same thing with adults. Like, not all adults get adjusted the same way. What's the best adjustment for that person? So it's not all created the same, but there is a plethora of ways to adjust so everybody can fit into that and get those benefits.
Absolutely.
So, is it safe? Yes. Does it look the same as adults? No. What can we possibly see kids for and help them with? Like, why would they even come in here and get adjusted? Because most people think what? Pain and car accidents is what most people think about with chiropractors. So why would we see a kid?
Yeah. So I
or
mean,
a baby.
Right. So a lot of times when you're born, you go through that birthing process, is the first time that your spine gets misaligned. And when a spine gets kinked and misaligned, it compresses on the nerves that come out in that area. So a lot of times when kids are younger, especially like if they're newborns or the first couple of years of their life, they might not necessarily get pain from that. But what they could get is they could get what we call like torticollis, which is where a muscle is super tight. And you may notice that your baby's head always tilts or turns or both to one side. We can see if maybe so there's all kinds of bones that make up the bones that make up your skull, and sometimes same thing coming through the birth canal or ways that they sleep or something can cause one side to develop more than another side, and they can be off balance, and that's where babies have to wear like helmets, and that chiropractic can help with that. They may not latch properly or have difficulties feeding. Even older kids can have popping or clicking in their jaw, so chiropractic can help with that. Do you want to name some? I hit the non-pain points up in the head.
Yeah, I mean, so many things. So let's just hit a couple more things. I would say, and like to emphasize again, like, people know for pain and for car accidents. So by all means, if your child is in the car with you for a car accident, please get them checked as well.
Yeah,
and we can absolutely do that here. Some kids get pain, which is very abnormal for a child to really get pain. But if they do have it, or if they're getting things like headaches, which we see an increase in through the more technology we use, we are really good at helping with those things as well. And then overall, I think at the end of the day, chiropractic helps your body function better and do its job that it is designed to do. So I think sometimes when we talk to these different doctors and we say, hey, like, we've had kids who were having all these ear infections, and we started seeing them and they no longer had to go get tubes in their ears and they hardly ever get an ear infection. They don't understand why, and they think that we are just treating the ear infection. We're not treating the ear infection. We're not treating anything like that. We are going in and finding the stress in their body and removing that stress so their body can function at a better rate. So when we're looking at things like, think ear infections here, you have tubes in your ears that need to drain out that. Well, what do you think controls some of that tube and that draining? Muscles are going to have an impact on that. And what feeds into those muscles to tell the muscles how to contract and relax and work? Nerves. And where do those nerves come out from? Your spine. And where does that get the information from? Your brain. So if there's any block in that process or something that's making or slowing it down, that's a stress that we can deal with, we go in and eliminate that with an adjustment. And then their body just works better. The tubes can drain better. They're not having to get surgery. So those are things that we have seen in the office. And clearly there's a whole plethora of other functional changes that we do see in kiddos that we see them for.
And I would like to note bedwetting too, because a huge thing is, like, we're not competing and we're not battling the pediatrician. There's a time and a place for both of us. So sometimes I feel like there are things that they do really, really well. And sometimes there's things that are like super frustrating. They're like, why is this happening? And a lot of times a nerve can be pinched, which can cause or contribute to bedwetting. I have heard endless amounts of time, like my child got adjusted and they stopped wetting the bed. And that lasted for a period of time. And then they're like, let me go get my child checked in. They bring them back into the office and they need another adjustment in that area. And then the bedwetting stops. So it can be a nerve issue. That can go the same thing with pooping.
Yep, using the bathroom.
So using the bathroom, constipation, that kind of stuff. And then overall, just like a general consensus, making sure that their spines are developing properly from beginning to end, is a good way to think about it. And so kids grow and they have growth spurts. So sometimes keeping proper alignment can help avoid growing pains, but also growth spurts with spinal weakness, so abnormal posture that can come from heavy backpacks, computer use, technology use, can also lead into things such as scoliosis, and it can make that stuff get worse. And there is definitely like a huge component that chiropractors can help with that massively. And not everyone is properly trained in how to manage scoliosis, and there's special additional training to do that, and so ways that you can actually look at reducing the curve and making sure it's not getting worse as time goes on. And there is a couple special techniques out there, but the one that like we know is called chiropractic biophysics, CBP for short. If you're not in this area, go to idealspine.com and you can find a provider near you that will say, it needs to say they have basic certification, advanced certification, and there are additional doctors, not us, I'm not even claiming that's us because it's not, that have training on how to brace those things so they can help avoid getting surgery. So that's huge when you're talking about it, because we don't want to cut on a little spine if we don't have to.
No, and I think a good part to point out, because that is our last one to talk about today with like, can we do anything about scoliosis, is when I did talk to this other medical doctor, a lot of questions were presented in the fact of like, well, how do you quantify it versus how other doctors quantify scoliosis and those type of things, which I thought was a really great question, because the mainstream way of doing it is a lot of kids will get checked in school and they think they might have something, so they send them to their pediatrician and they check a little further. They might order an x-ray if they think they need to see, if they think there's a curve there. They're going to look at the x-ray, they're going to measure if there is any type of curve or like listing, and it has to hit a certain amount and degree in order for it to be classified as a scoliosis.
Right.
And typically what they will do is if it does not hit that degree, they will wait.
Mm-hmm.
They will sit and they will wait and they say, we will check on it. But just like Dr. Johanna said, if there is weakness, postural weakness, accompanied with all these other stressors like backpacks and school and sports and things like that, that's not necessarily going to get better. We can do a lot during that waiting period to prevent it from getting worse.
Yep, absolutely. Absolutely. We absolutely can. So it's a good intervention if your child comes home and they say, oh, the school nurse checked me and they think I have scoliosis, or asking your pediatrician and their pediatrician says, sure. But like, I'm not going to lie, I don't have x-ray vision. So x-ray is a very diagnostic tool to figure out scoliosis, like not to go on a long tangent about it. But that's like a main factor for us, and getting in there and doing things as a preventative measure, because if you sit and wait, it will absolutely get worse. That's what the research says.
Yeah, so we don't have to sit and wait. There are things to do. That's definitely Dr. Johanna's jam. She's the one with the training in scoliosis. I do not have that, but as she talked about, there's even chiropractors that are in the area that are not us, that if it was at a point that maybe you didn't want to go down the surgical route and that type of thing, there's other bracing that chiropractors can do that is a little bit different.
Yeah.
So we can talk about that at another time.
Yeah, if that sounds like something that like you're going through right now, absolutely reach out to us and I'll get you in contact with those doctors, because sometimes the website's not up to date or properly there. So I will pass that information along to you so we can hopefully help your child avoid getting rods in their back if that's not a goal of yours.
The last one I want to mention, since before we fully hop off, we answered all the questions, but Dr. Johanna became a chiropractor because she got adjusted as a kid and she noticed her asthma got better. She didn't have to take her inhaler anymore.
Yep.
So as we were talking about functional things, we do see where a lot of kids get a lot better when we're adjusting them and removing that stress when it comes to respiratory issues or allergies and colds. So that's also just another one to throw in that toolbox of things that we help the body function better, and the body heals very nicely when you give it the opportunity to, which is really cool.
Right. And because I love testimonials, I'm gonna give two real quick, and then you can throw one if you want. First is I adjusted a baby not too long ago that was not latching on one side. First adjustment, Mom fed the baby before leaving the office. Baby was already latching on the other side that they were not prior. So super cool, super awesome. One adjustment. So super gentle. The second one is, in one of my favorite kiddos I used to treat came in for headaches, and I saw her dad, and her dad was like, I mean, the pediatrician doesn't really know what to do. I don't know who they were seeing, but she's having headaches. They think maybe she needs glasses. So they got her eyes checked out, whatever. So I'm like, well, why don't we check her spine? Because the nerves in the neck could be compressed, especially with doing all the technology and the computer stuff that they do in school. We get her adjusted a couple of times. She no longer has headaches, and she doesn't have to be on medication as a young child, tearing up her gut and that kind of stuff. So those are like two super awesome things that have happened along the way of this chiropractic path for us.
I've definitely seen a little one who had surgery scheduled for getting tubes in their ears, and we started seeing them and adjusting her a couple times and talking about other inflammatory processes that can help contribute to those things. And she didn't have to get tubes put in her ears, which is pretty cool.
Yep, that's super awesome. So absolutely, we can see your kiddos.
Yeah, and it's safe and all that fun stuff. But if you have extra questions, please comment them down below. Let us know and tag us so we can come back and answer them. And as always, we appreciate you and thank you for tuning in.
And it's important to note before we sign off that we will co-manage with your pediatrician.
Yeah,
okay?
absolutely.
So we are totally in the game of co-managing and making sure that everyone is on the same path to obtain the ultimate goal, which is to make sure that little one is as healthy as possible.
Absolutely.
So, until next Tuesday.
Bye.
Bye.